Welcome to our comprehensive guide on unlocking the benefits of anastrozole, the effective treatment for hormone-positive breast cancer. In this video, we will delve into the details of this medication and explore how it can help in the fight against this common form of breast cancer. Anastrozole, an aromatase inhibitor, works by reducing the amount of estrogen produced in the body, which is essential in hormone-positive breast cancer cases. By inhibiting the enzyme responsible for converting androgens into estrogen, it effectively disrupts the estrogen-driven growth of cancerous cells. We understand that navigating through breast cancer treatment options can be overwhelming, which is why we have compiled this comprehensive guide. Whether you are a patient, caregiver, or simply seeking information on this topic, we aim to provide you with accurate and reliable insights. Understanding hormone-positive breast cancer. Hormone-positive breast cancer is one of the most common types of breast cancer, accounting for approximately 70% of all cases. This type of breast cancer is characterized by the presence of hormone receptors, specifically estrogen and progesterone receptors, on the surface of cancer cells. These receptors allow the cancer cells to receive signals from hormones, promoting their growth and proliferation. Hormone-positive breast cancer is typically treated with hormone therapy, which aims to block the effects of estrogen on cancer cells. This form of treatment can include medications such as tamoxifen, fulvestrant, and anastrozole, which we will focus on in this guide. What is anastrozole? Anastrozole, sold under the brand name Arimidex, is an oral medication used primarily in the treatment of hormone-positive breast cancer in postmenopausal women. It belongs to a class of drugs known as aromatase inhibitors, which work by reducing the production of estrogen in the body. Approved by the U.S. Food and Drug Administration, FDA, in 1995, anastrozole has become a well-established and widely used treatment option for hormone-positive breast cancer. It is typically prescribed as an adjuvant therapy, which means it is given after primary treatment, such as surgery or radiation, to reduce the risk of cancer recurrence. How does anastrozole work? Anastrozole works by inhibiting the enzyme aromatase, which is responsible for converting androgens, or male hormones, into estrogen. By reducing the production of estrogen, anastrozole effectively starves hormone-positive breast cancer cells of the hormone they need to grow and multiply. Unlike other hormone therapy medications, such as tamoxifen, which block estrogen receptors, anastrozole targets the root cause of estrogen production. By directly inhibiting aromatase, anastrozole offers a more potent and targeted approach to suppressing estrogen levels in the body. Benefits of anastrozole in hormone-positive breast cancer treatment. The use of anastrozole in hormone-positive breast cancer treatment offers several key benefits. Firstly, it has been shown to significantly reduce the risk of cancer recurrence. Studies have demonstrated that anastrozole can decrease the risk of recurrence by up to 50%, making it a valuable tool in preventing the return of hormone-positive breast cancer. Secondly, anastrozole has been found to be more effective than tamoxifen in reducing the risk of contralateral breast cancer, which refers to the development of cancer in the opposite breast. This is particularly important for patients who have a higher risk of developing cancer in both breasts. Additionally, anastrozole has a favorable side effect profile compared to other hormone therapy medications. While it is not without side effects, as we will discuss later in this guide, anastrozole generally causes fewer blood clots and uterine cancers than tamoxifen, making it a safer option for many patients. Anastrozole dosage and administration. The dosage of anastrozole prescribed will depend on various factors, including the stage and characteristics of the cancer, as well as the patient's overall health. It is important to follow the dosage instructions provided by your healthcare provider and to take the medication at the same time each day for optimal results. Anastrozole is typically taken orally as a tablet, with or without food. It is recommended to swallow the tablet whole with a glass of water and to avoid crushing or chewing it. If you have difficulty swallowing tablets, speak to your healthcare provider who may be able to provide alternative options. The standard dosage of anastrozole for postmenopausal women with hormone-positive breast cancer is 1 mg per day. However, your doctor may adjust the dosage based on your individual needs. It is crucial to continue taking anastrozole for the prescribed duration, even if you start feeling better or experience improvement in your symptoms. Potential side effects of anastrozole. Like any medication, anastrozole can cause side effects. It is important to be aware of these potential side effects and to communicate with your healthcare provider if you experience any concerning symptoms. Common side effects of anastrozole may include hot flashes, joint pain, fatigue, mood changes, and bone thinning. These side effects are often manageable and tend to improve over time. However, if they become severe or persistent, it is essential to seek medical advice. In rare cases, anastrozole may lead to more serious side effects, such as osteoporosis, fractures, or an increased risk of cardiovascular events. Your healthcare provider will carefully assess your risk factors and monitor your bone health and cardiovascular function throughout your treatment. Safety precautions and considerations when taking anastrozole. Before starting anastrozole, it is crucial to inform your healthcare provider about any pre-existing medical conditions, allergies, or medications you are currently taking. Certain medical conditions, such as liver disease or osteoporosis, may require special consideration and monitoring while on anastrozole. It is also important to note that anastrozole is not recommended for use in premenopausal women or women who are pregnant or breastfeeding. This medication is specifically formulated for postmenopausal women and may have adverse effects on hormonal balance during reproductive years. Furthermore, anastrozole can interact with other medications, including hormone replacement therapies or certain antidepressants. Always consult with your healthcare provider or pharmacist to ensure there are no potential drug interactions that could compromise the effectiveness or safety of anastrozole. Alternative treatments for hormone-positive breast cancer. While anastrozole is a highly effective treatment option for hormone-positive breast cancer, it is not the only option available. Depending on individual circumstances, your healthcare provider may recommend alternative hormone therapy medications, such as tamoxifen or fulvestrant. In some cases, combination therapies may be considered, combining anastrozole with other medications to enhance treatment efficacy. Your healthcare provider will evaluate your specific situation and tailor the treatment plan accordingly to ensure the best possible outcome. Frequently asked questions about anastrozole. Is anastrozole a chemotherapy drug? No, anastrozole is not a chemotherapy drug. It falls under the category of hormone therapy medications, specifically aromatase inhibitors. Can I drink alcohol while taking anastrozole? It is generally recommended to limit alcohol consumption while taking anastrozole. Alcohol can increase the risk of certain side effects, such as liver problems or osteoporosis. Can anastrozole be used to treat other types of cancer? Anastrozole is primarily used in the treatment of hormone-positive breast cancer. Its effectiveness in other types of cancer has not been well established. How long do I need to take anastrozole? The duration of anastrozole treatment will depend on various factors, including the stage and characteristics of the cancer. It is typically prescribed for a period of 5 to 10 years. Conclusion: the importance of anastrozole in hormone-positive breast cancer treatment. In conclusion, anastrozole plays a vital role in the treatment of hormone-positive breast cancer. As an aromatase inhibitor, it effectively reduces estrogen levels in the body, depriving cancer cells of the hormone they need to grow and spread. Anastrozole offers several benefits, including a reduced risk of cancer recurrence and contralateral breast cancer. While anastrozole is generally well tolerated, it is important to be aware of potential side effects and to discuss any concerns with your healthcare provider. With proper monitoring and adherence to treatment, anastrozole can significantly improve outcomes for individuals with hormone-positive breast cancer. Remember, this guide is intended to provide general information and is not a substitute for professional medical advice. If you have any specific questions or concerns about anastrozole or your breast cancer treatment, consult with your healthcare provider for personalized guidance. Together, we can unlock the benefits of anastrozole and pave the way to a brighter future in the fight against hormone-positive breast cancer. Thanks for watching.